Hello, everyone. I'm Megan, full-time faculty and registered nurse for the American Academy of Facial Aesthetics. Welcome into my home. I have a patient, my favorite patient, with me today. This is my husband, Skylar. Skylar had a traumatic brain injury 10 and a half years ago from a car crash that very easily could have taken his life or left him immobile or nonverbal. Miraculously, he made a very full recovery and was just left with numbness and delayed sensation on the left side of his body, then some neurological side effects, i.e. headaches and migraines. Skylar, tell us a little bit about your headaches and migraines that you've dealt with for the past decade.
My migraines have really been one of those things that I feel like has plagued my life for years and years and years. Ever since I did have that traumatic brain injury, it was one of those kind of sensations, I guess, that I thought I would have to deal with the rest of my life. It was one of those things that I tried to put to the back of my head so that I'd try to forget and try to stay so busy that I would forget about them. And it wasn't until I got home that all of a sudden it would just feel like everything would just kind of, all the stress and all the tension of the day would just finally just pile up. And I had these worst headaches.
Right. We've been married for about 5 years, and shortly after we got married, I really started noticing Skylar's headaches and how they were affecting his day-to-day life. How often were you having headaches?
I was probably having them every other day, sometimes every day, just kind of depending on my hydration and everything.
So 15 plus times a month he was dealing with headaches, sometimes migraines. That is awful, and that just makes life a little miserable. When I started getting into aesthetics, I was extremely intrigued by neurotoxin being used to treat migraines and headaches. Rightfully so, as I had an ideal candidate living in my house. And Skylar in the beginning was a little apprehensive to receive neuromodulator treatment, just because of the connotation that it has occasionally. And so I worked very diligently to change his mind about receiving Botox neurotoxin treatment and how it's appropriate for everyone. And we went forth with standard treatment, treated Skylar's frontalis, glabella, crow's feet, temporalis, and masseters. Once you found out that these could be used to treat your headaches, you were pretty intrigued. Tell us a little bit about how you felt after you received your first ever standard neurotoxin treatment.
Well, honestly, once I finally got the treatment, I didn't notice it for the first day or two, so I wasn't really quite a firm believer. But then as time went on, I started to just notice a more natural relief. And then it was one day, literally, we were sitting in the car, and you put your hand on my leg, and you're like, Sky, how are your headaches doing? And that was when I just recognized that they weren't there, that I hadn't been having that reoccurring pain in my head for the last couple days.
Right, and it often manifested as a lot of tension and pressure. And when we use neurotoxin, it relaxes those muscles, and that's where we find relief. A lot of times, patients don't realize how successful their treatment has been until it's started wearing off. This is something I've noticed particularly in you when it starts wearing off, your headaches and your tension and tightness in your head start coming back. Tell us a little bit about that sensation when your neurotoxin is about worn off and you can notice a big difference.
Oh, it's very noticeable. Like, there is no questions asked when the toxins are starting to wear off, because I can instantaneously start to feel a lot of that kind of tension headaches all through the sides of my head, just starting to rebuild once again in my head. And that's when I'm like, all right, Meg, time to dose me right back up.
Right. So be honest here. Not only do you love the therapeutic relief, do you love the aesthetic benefit of neuromodulator treatment as well?
Absolutely. Of course.
I'll be sure to share a before and after. He has seen good relief from some fine lines and wrinkles too, as well as headaches. The other thing that we've had great success in, Skylar is a very active guy, very busy, works hard, works extremely hard at the gym, and carries a lot of tension through his neck and trap. So we started with trigger point therapy on Skylar. I realized when I was learning about trigger points that he was the ideal candidate. When I started assessing through the base of his skull, the sides of his neck, and his trapezius muscle, I really started recognizing that he had a lot of trigger points, and I was able to mimic that pain that you were having, and it would radiate to other areas in his body or his head and neck. And so we proceeded with trigger point therapy, which you were also a little nervous about. Skylar's not a big fan of needles, and it can require multiple pokes. Tell us a little bit about trigger point therapy.
Well, that was another one of those things that was kind of hard for Megan to sell me on initially, until I had actually talked to some other people, and they said that it really had been a game changer for them. And it wasn't until after, during the whole process, it was kind of an uncomfortable process when you were poking me with the needles. But once it had been a couple days, I started to really recognize that I was able to have more movement in my head. I was able to turn my head more. I had just a more natural way to move my shoulders and my traps, and everything just felt better.
A big increase in his range of motion for sure, and then great relief of that tension and pressure as well. So we've had phenomenal success in treating Skylar's pressure, headaches, tension, everything with neuromodulator treatment and trigger point therapy. In our home, it's something that we place great value on. It's super important to us, and we really firmly believe that this changes lives because it has changed our own life.
Absolutely.
We can't stress enough the importance in being educated about these things. As healthcare providers, we most often go into healthcare wanting to help those around us and to better people's lives. And this is a therapy that I'm able to offer that really does benefit people's lives. And it has changed my own life as it's changed my husband's life. Please stay tuned and check out our AAFE channel and social media pages for more information on trigger point therapy, neurotoxin for headaches, and all of the other amazing modalities that we're offering. Please subscribe. Thank you.